Hi all, good afternoon. Dr. John Hayes, and welcome once again. I'm going to continue the discussion that we started yesterday on our brief demonstration on laser and light therapy, because there were some really good questions, and you may have seen the first video that we filmed were unable to save, so we redid it, but there were still some questions unanswered. So here we go. So laser therapy, sometimes called low-level light therapy, or LLLT, is more correctly called photobiomodulation. And the reason for that is that PBM, or photobiomodulation, really describes the effects that light energy has on the human body. And it's really fascinating. I also mentioned in yesterday's video that there are a number of different applications now for laser and light therapy. In fact, one of the biggest areas that is being promoted, and has been for many, many years, is veterinary medicine. And unfortunately, some people are really willing to spend money on their pets and not spend money on themselves, which is another story, but also is one of the reasons that laser therapy is underutilized. So there's a number of different ways that light therapy or laser therapy can be administered. Probably the most common way is through handheld devices, but there are now newer lasers, some which are automated and some which are wearable. The issue, however, with some of the automated devices becomes the distance between the body and the application of light. I also mentioned yesterday something that really came to light again in the clinic today with a patient or two with very, very significant spinal issues, is that so much of effective laser therapy depends upon the operator. In other words, the application, the location of the application, the direction that the laser beam is focused, as well as programming the equipment properly, goes such a long way towards making a very, very effective treatment. The other thing to keep in mind is that laser therapy is heavily researched. It's way more heavily researched than most people realize. Certainly now, I've been doing laser therapy pretty intensely for about 12 years, and before that kind of dabbled a little bit, mainly because I was not happy with the devices and the systems that are out there. Well, I can honestly say that with what we've done in the last 12 years with the Thor laser and James Carroll's research in particular, it's been a game changer for ourselves and our patients, not only in the main clinic, but also patients we work with remotely now who are able to guide through a lot of this have really had some really remarkable changes. So again, laser or light therapy has a lot of different uses, but the primary uses center around the ability to reduce inflammation at a deep level, control pain. Again, there's two separate characteristics in terms of how the therapy is administered, but those are the effects. And one of the most exciting things about laser therapy, and I think that is probably what's going to come out of the research as to why it's so powerful in conditions like peripheral neuropathy and many, many other diseases, by the way. There's a whole host of other disorders now that we're really just looking at the applications of light therapy with. And we'll have more for you on that as time goes by. But the underlying mechanism appears to be that appropriate laser and light therapy helps the body's own production of stem cells, which is huge, and in many cases may be more effective than some of the what I call pseudo stem cell, or let's say less than therapeutically appropriate stem cell injections. And I firmly believe, having treated thousands of patients over many, many years with this, that is indeed what's going on, because one of the biggest advances that we've been able to see and able to reproduce is that we are turning cases around, or patients around, that we're told there's no help, there's nothing else that can be done, and so on and so forth. And oftentimes these are people that have been through traditional pain management and failed. So all in all, very exciting. Great tools. Thank you everybody for your questions. Darlene, hi everybody else for watching today and yesterday, and all your comments and messages afterwards. So again, let us know below what you'd like to learn more about laser. Would you like to see some demonstrations, that type of thing? Really, just let us know what's going to help you the most, because we really want you to know. And above all, questions, concerns, address them. You can leave comments here. You can text them, or you can call the main office at 781-659-7989, and we take texts all the time literally from around the world. So if that's easier for you to do, we're more than happy to take your message that way as well. All right, thank you so much, and we'll talk to you soon. Take care.